I don't want to get all set up and everything. I'm kind of moving around the office, getting ready to work. But as you can see, I just posted something that said it takes a grade 1 hip flexor strain. We all know hip flexor gets tight when we sit down. A lot of us might feel pain in our hip, our back, our this or that. Remember, anytime we pull or strain, which straining and pulling we're going to say is the same thing for the purposes of this video. Tendon is the muscle, how should we say, not ligament, but the thinner part of the muscle where the muscle belly turns into the tendon. A lot of times in our elbow, when we get a serious injury or we think it's really bad and we can't really pinpoint it, but it hurts to maybe do like a pull down or a push or a press or some kind of stretch, and then like we feel pain in our elbow or our knee or our hip. These a lot of times are tendonitis. And oftentimes people are so hell-bent on saying exercise this and movement that, and we gotta move and we gotta move and we gotta move. Well, what's happening when you have these micro tears and these micro stretched and ultimately injured tissues and tendons that just showed that if you're injured, it could take 2 to 3 weeks to heal. And that's a grade 1. So that's assuming it's like the most minimal grade that is, detectable on some kind of imaging or a reliable practitioner saying like, this is the grade strain you have. So why would somebody think that multiple exercises and multiple attempts to increase blood flow and, move it or lose it kind of, attitude would make you better? If anything, you're going to need that 2 to 3 weeks to ice a little bit, rest a lot. Resting can consist of actual sitting, doing not much or very mild walking, along with knowing that you can do what we call passive therapy or passive progressive therapy, because active motion, when you begin to engage a muscle, is oftentimes a telltale sign of that type of tendinous or muscle injury, because it's active motion, where those ligament injuries are, believe it or not, just passive motion or passive type of therapy where you're not really engaging. And so what happens is we can affect or fix in an elevated or escalated type of treatment plan to target tendons that are injured and actually accelerate healing through passive therapy, because the tendon is not contracting and aggravating the tears, whereas opposed to trying it yourself and doing all these exercises is, yes, I'm sorry, making it worse. I try to, make it so that people can have the most efficacious outcomes possible via the most desirable outcomes possible when it comes to these kinds of lifting or exercising or just whatever happenstance, oopsie doopsie injuries, instead of panicking and trying to do all the different things on TikTok, which when a 20-year-old TikToker who's got a great physique is giving you advice based on their other 20-year-olds, outcomes because of some tightness somewhere, it's not really applicable to the 30, 40, 50, 60-year-old us's out there that have these tendinous injuries or these ligamentous injuries, either one, opposite, however, and the approaches are so different in terms of healing them. And rest and repair is vital to actually getting tendons to heal. So let it be something you take with you today, and I hope you have a great weekend.